Hello and welcome to this quick video on the use of COVID vaccinations during pregnancy and lactation. My name is Jessica Jones and I am a clinical pharmacist with an interest in the safety of medicines in pregnancy and lactation. This video was made in support of World Breastfeeding Week 2021, which focuses on a shared responsibility of all healthcare professionals to protect breastfeeding where possible. So, what is COVID-19? I'm sure most of us know by now. It is a virus caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, which is a positive single-stranded RNA virus that is contagious in humans. And it is spread primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's really important to practice respiratory etiquette, so coughing into a flexed elbow, for example. The best way to prevent and slow down the transmission, as everybody knows, is to wash your hands, wear a face mask, practice social distancing, and where inside, make sure that the area is well ventilated. Most people that are infected with COVID-19 will only experience mild to moderate respiratory illness, and they should recover quite quickly without requiring any kind of special treatment. But older people and those with underlying chronic medical conditions are more likely to develop serious illness. COVID-19 affects different people in lots of different ways, and like I said, most people will develop only mild to moderate illness and recover without any need for treatment or hospitalization. So generally, the most common symptoms are fever, a continuous dry cough, and fatigue or tiredness. Less commonly, people will get aches and pains, sore throat, headache, loss of taste or smell. But generally it's just kind of the dry cough and the fever and general malaise. Serious symptoms, though, can result in difficulty breathing, shortness of breath, chest pain or pressure, and loss of speech or movement, and these are things that would require hospitalization. On average, it takes about 5 to 6 days from when someone's infected with the virus for the symptoms to show, but it can take up to 14 days for that to show too. When it comes to pregnancy then, pregnant women don't appear more likely to contract the infection than the general population do, and about 2/3 of women who test positive for COVID-19 in pregnancy won't have any symptoms. But if they do get symptoms, and especially if they're at the later stages of their pregnancy, they can become seriously unwell, and especially if they have underlying health conditions as well. If mums do get that symptomatic COVID-19, it is associated with a 2 to 3 times greater risk of iatrogenic preterm birth. And that could potentially be from the lower threshold for admitting pregnant women that have COVID-19 with severe symptoms. The median gestational age at birth found from an initial study was found to be about 38 weeks. So that's anything from 36 to 39 weeks roughly. So that's how preterm we're looking. But aside from preterm birth, there isn't any evidence that COVID-19 infection alone during pregnancy has any adverse effect on the fetus or on neonatal outcomes. Like I said, more than 2/3 of pregnant women with COVID-19 will be asymptomatic. Compared with non-pregnant women though, pregnant women with COVID-19 will have higher rates of intensive care unit admission. But as I mentioned previously, this might reflect the lower threshold for admission to ICU rather than them having a severe disease. Although it's very rare for pregnant women to become seriously ill if they do get COVID-19, it's more likely that it will happen later in pregnancy. And if that happens, that is what will increase the risk of preterm birth. While the chances of having a stillbirth are low, there is some emerging evidence that the risk might be higher if you have COVID-19 at the time of birth, but there isn't a whole lot of information on that at the moment. So the current advice for vaccination during pregnancy is that vaccination should be offered to all pregnant women at the same time as the rest of the population. So that's based on age and your clinical risk. Trials testing the vaccine during pregnancy and breastfeeding haven't taken place, but there have been so many women around the world that have been vaccinated and so few reported instances of problems that it's negligible. Vaccines are equally efficacious no matter what stage of pregnancy the woman is in. And the Joint Committee on Vaccination and Immunisation advise that you don't need to take a pregnancy test before you're vaccinated, and that if you're planning to become pregnant, you don't need to delay pregnancy after a vaccination. But since COVID-19 has more serious complications in later pregnancy, some women may choose to delay their vaccine until after the first 12 weeks, which are the most important for the baby's development, and will plan to have the first dose anytime from about 13 weeks onwards, so that they are fully vaccinated by the time they're due to deliver. So at this point in time, there are 4 COVID-19 vaccinations approved for use. That's the Moderna, Oxford AstraZeneca, Pfizer BioNTech, and Janssen, which will be available later this year. None of these vaccines will contain any ingredients that are known to be harmful to pregnant women or to a developing baby. They don't contain live vaccines, so they cannot cause COVID-19 infection in the mum or the baby. There has been some studies shown that pregnant women should be offered the Pfizer BioNTech or Moderna vaccines, and that is purely because most of the safety monitoring data relates to those 2 vaccines. If she's already had the Oxford AstraZeneca vaccine for the first dose and didn't have any serious side effects, she can have that again as a second dose. Depending on age, though, the government has advised that individuals under the age of 40 should be offered an alternative vaccine to the AstraZeneca one, but that's purely based on the risk to benefit ratio for that group specifically. It doesn't have anything to do with pregnancy. So when it comes to having a conversation with mums about the risks and benefits of vaccination during pregnancy, the benefits are obviously that vaccination is effective at preventing COVID-19. And as well, COVID antibodies are passed through breast milk, so if she is planning on breastfeeding, that also has benefits for the baby as well. Lots of women are worried that you can get COVID-19 from vaccination. Obviously, like I said, it doesn't contain any live coronavirus, so that's not possible. And it's worth mentioning to them that COVID is more dangerous during pregnancy, especially towards the end. Like I said, they are at higher risk for being admitted to intensive care, whether that's because there's a lower threshold or whether that's because they are genuinely more unwell isn't quite clear, but either way, it's worth being protected, I suppose. The risks then are that COVID-19 vaccines haven't been tested specifically in pregnancy. But as I mentioned, there's been more than 100,000 pregnant women who have had a COVID-19 vaccine and it's not raised any safety concerns. Other risks are just risks that you would get from any vaccine, not necessarily during pregnancy, but these are things like injection site reactions, fatigue, headache, muscle pains, fever and chills, and joint pain. There is an extremely rare, but obviously quite serious side effect of thrombosis, so that's blood clots, which have been reported for the AstraZeneca vaccine. And for that reason, the Pfizer BioNTech or Moderna should be offered to pregnant women where it's available. Like I said before, though, if they've already had the AstraZeneca vaccine with no problems, then they're okay to use that one again for their second dose. I've put this slide in just for a bit of information, really, because I found it quite interesting. Like I mentioned, the vaccine does provide some level of protection for breastfed infants. A recent study has shown that breast milk from mothers vaccinated against COVID-19 does contain antibodies which can help to protect their infants from the virus. So I've put a little link in there, definitely worth having a read if mum is considering breastfeeding. And finally, I just wanted to pop this little bit of information in here. This is regarding fertility in the COVID vaccine. So I know when it first came out, and especially when I was getting mine, I heard afterwards that, it can reduce fertility. And to me, it didn't seem plausible. So I looked into it, and the Royal College of Obstetric Physicians has produced a statement that says there is no biologically plausible mechanism by which current vaccines would cause any impact on women's fertility. So that is not something that mum needs to be worried about. So this was a very quick just overview of COVID vaccinations in pregnancy and lactation. I hope that it was helpful and informative, and if you have any questions at all, please feel free to send me an email at jessie.jones@nhs.net. Thank you so much.